Good day! I am Nicole Sumagaysay Colot from ESN 2B and I'll be performing antenatal abdominal examination, Leopold's maneuver, and auscultation of the fetal heart.
Preparation. Check the doctor's order. Gather equipment. My hypo tray contains the following: rubbing alcohol, tape measure, stethoscope, watch with the second hand, jot down notebook, and red and black ball pen. Greet the client and introduce yourself.
Good morning, ma'am!
Morning!
So I am Nicole Sumagaysay Colot, a student nurse from Central Philippine University. May I know your name, ma'am?
I'm Helen Colot.
Okay, Mrs. Helen Colot. So today, ma'am, I'll be performing the antenatal abdominal examination, the Leopold's maneuver, and the auscultation of the fetal heart. So ma'am, in this procedure, it requires you to expose your abdomen, from your hips to your upper abdomen. I hope it will be alright for you, ma'am.
Okay.
Explain the procedure to the client and the rationale for each step as it performed.
The procedure, ma'am, I will first inspect your abdomen. It is a visual examination to know the normal and abnormal signs of pregnancy. Then, I will measure the fundal height. I will be placing a tape measure from the superior border of your symphysis pubis across the contour of the abdomen to the fundus along the midline. It is done to determine the fetal growth and development of your baby. After that, I will be doing the Leopold's maneuver. I will be placing my hands to your abdomen to determine the position of your baby. Lastly, I'll be performing the fetal auscultation using a stethoscope. Here, I will be placing the bell of the stethoscope over the convex portion of the fetus closest to the anterior uterine wall, listening to it by pressing firmly and gently to your abdomen. Then, I will count in 1 full minute while my other hand is on your radial pulse. It is done to measure the heart rate and rhythm of your baby.
Instruct the client to empty her bladder.
Proceed, ma'am. You need to empty first your bladder because it might be uncomfortable for you during the examination. Is that okay? So, are you comfortable now, ma'am?
Yes.
Provide privacy. Perform hand hygiene.
So, ma'am, I will position you for the examination.
Okay.
Place client in supine position with knees flexed. Place pillow under the head for comfort. Place a small pillow or a folded towel under the client's right hip. Place her arms by her side.
So now, ma'am, I'll be exposing your abdomen.
Drape the client with a draw sheet. Expose her abdomen below the breast to the symphysis pubis. Inspection of the abdomen. Inspect the abdomen for the following: scars, diastasis recti, hernia, linea negra, striae gravidarum, contour of the abdomen, state of umbilicus, and skin condition. Measuring the fundal height.
So now, ma'am, I'll be measuring the fundal height.
Place the zero line of the tape measure on the superior border of the symphysis pubis. Stretch the tape across the contour of the abdomen to the top of the fundus along the midline. End record. Performing the Leopold's maneuvers.
Next, ma'am, I'll be performing the Leopold's maneuver. But before that, I will help you relax your abdominal muscles first.
In relaxing the abdominal muscle, bend the client's knees slightly and do relaxation breathing. Warm hands by rubbing both palmar surfaces of your hands. First, Leopold's maneuver or the fundal grip. Stand at the foot of the client, facing her, and place both hands flat on her abdomen. Palpate the superior surface of the fundus. Determine consistency, shape, and mobility of the fetal part in the fundus. Second Leopold's maneuver, or the umbilical grip. Face the client and place the palms of each hand on either side of the abdomen. Palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus while the right hand palpates the opposite side of the uterus from top to bottom in a circular motion. Then hold the right hand steady and repeat palpation using the left hand on the left side. Third Leopold's maneuver, or the Pollock's grip. Still facing the client, gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger, and try to press the thumb and finger together. Determine whether the presenting part feels like the fetal head or buttocks and whether it is engaged. Fourth Leopold's maneuver, or the pelvic grip. Facing the client's foot part, place fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments, pressing downward and inward in the direction of the birth canal. Allow fingers to be carried downward. This maneuver is performed only in cephalic presentation. Auscultation of the fetal heart.
So now, ma'am, I will proceed with the auscultation of the fetal heart.
Place the bell of the stethoscope over the convex portion of the fetus closest to the anterior uterine wall. Since the fetal position is cephalic, place the stethoscope at the lower quadrant. Listen by pressing firmly and gently. Count in a full minute while the other hand feel for the mother's radial pulse. Inform the client about the findings.
So, ma'am, I will share with you the findings of the examination. So, during the inspection, all the signs are within the normal signs of pregnancy. For the measurement of the fundal height, it is 36 centimeters, which means the uterus is clinically at 36 weeks that corresponds to the date. In the Leopold's maneuver, upon assessment, I have found that there is a single fetus in longitudinal line. Cephalic presentation, the head is 5 feet palpable and the back of the fetus is at the right side of the abdomen. Lastly, during the auscultation, there is a presence of fetal heartbeat with a rate of 130 beats per minute, which is within the normal fetal rate of 120 to 160 beats per minute.
Provide client safety and comfort. Perform hand hygiene.
So thank you for today, ma'am. If there is any problem, just kindly inform the nurses station so that we can accommodate your needs as soon as possible.
Document findings and remarks if any.